Good morning, everybody. Good morning, everybody, and welcome to AIM Impact on Your Health. AIM Impact on Your Health, where every day our goal is to have you learn at least one thing to help you live better and longer. AIM Impact on Your Health is heard each and every Monday, Wednesday, and Friday from 8 to 9 o'clock. I'm Dr. Dennis Courtney, and I'm with you each and every Monday, Wednesday, and Friday from 8 to 9. AIM Impact on Your Health, where each day you'll find current medical news, knowledgeable guests, fascinating health topics, and of course where we do encourage you to come on in to join in today. Well, it's to get us here. I first met this gentleman a couple of months ago at a conference, called the Top Doc Conference down in St. Petersburg, Florida. He certainly is a top doc, and I think you're going to enjoy him today. I refer to him as the gunslinger. I think you're going to find out why as the morning moves on. But Dr. David Minkoff, a physician from the Clearwater, Florida area, is going to be our guest today. Now, he's so well-rounded. We'll first talk about the generalities of approaching patients in an alternative sense. And then I hopefully will be able to have him focus on one of the things I've associated with him as being the go-to expert on, and that's this very complicated disease referred to as Lyme's disease. So, hope you enjoy meeting Dr. Minkoff this morning. In our conversation with Dr. Minkoff, you want to call in to ask a question or to make a comment. The number, of course, is 412-825-6262. That's 412-825-6262, and I will give that number additionally throughout the hour. Moving along at a quick pace here in the month of June, things have rolled along very smoothly. A couple of things still up and coming for the remainder of the month. Of course, I'll be out there in the community regime of addressing Strabane Trails Village. I'm going to be out there talking about eye issues, in particular cataracts and retinal diseases. Consider it a free seminar if you're in the area of North Strabane Township in the South Hills and the sort of moving into Washington County. Once you give us a call to find out from Sister Sarah how you can get involved with the Strabane Trails Village presentation. It's going to be at 2:30 on June 30th. The number to find out more information is to dial us up at 724-993-0500. It's 724-993-0500. Ask Sister Sarah about specifics on how to get in there, and she'll steer you in for sure. Speaking of eye issues, as if we haven't talked about it plentifully here on the show, and I think it's because a real focus is developed here. We know that we offer a way to reverse pretty serious eye diseases. We just found out last month that even one that, well, I wouldn't consider it less serious, but others do, the lens issues with cataracts, we find out we are hitting the ball out of the ballpark with a new program just put together a month ago. And we're going to be holding additional eye programs. We keep on doing this each and every month. The eye program for this month is going to be next week, Monday through Thursday here in the office. There is just so little time left. Do you think you'd like to be a part of it? Give Sister Sarah a call today. And probably after today, we won't be able to take any additionals. But today, if you think you'd like to be a part of it, give us a call at 724-993-0500 so that we just have enough time to get you enrolled. I'll be speaking to all of you on how this all goes next week with this next group of people. I'm not going to be surprised in the least. In fact, I'm very much just anticipating that the results that we got the first time were not an aberration, that we will get equally, if not even better results the second time through. And we have a mixture of retinal as well as cataracts in the group already, and I'll tell you all about it next week. And just keep adding to the list. Now, we have another cataract program, or I'll say eye treatment program for the month of July. The June and July programs are still going to be at an introductory offer and take advantage of them before price break begins in August. But June and July will continue to hold pricing at the place it was when we first started. And the eye protocol for the month of July, the last time to get in on this, is the 20th through the 23rd. So it's plenty of time into the future. If June is just too close for you, it's actually pretty close for us too. But with a month in preparation, you should be just fine to be involved in the next eye protocol. I haven't scheduled the month of August just yet. I'll be letting you know soon what those dates will be for the month of August eye protocol that we'll hold here. To find out more about the things that we offer, I suggest you go to our website. It's known as PittsburghEyeProtocol.com. That's PittsburghEyeProtocol.com. We describe what we do pretty clearly. We also link to Dr. Ed Condrat's website. It's known as Healing the Eye and Wellness Center, now located in Fort Myers, Florida. And Edward, of course, a Pittsburgh boy, born and raised. Initial practice was in Mount Lebanon for years. And that time, he was as conventional as the day is long with the way he treated and the issues that were treated. But about 15 years ago, that all changed. He took off to Phoenix, Arizona, and put together this very famous Ed Condrat eye program that we've been so successful with for years, and so too has Ed. Those, of course, are the retinal diseases, things like macular degeneration and glaucoma and diabetic retinopathy and retinitis pigmentosa, and the list keeps going on and on and on. A tragic set of diseases in this respect, nothing really to offer you in the conventional world. And that's where the miraculous stuff comes in. Ed figured out a way, in a natural way, without using anything invasive, no surgeries, no injections into the eye, no drugs, being able to accomplish that which is believed to be unaccomplishable and should be directly suited for it. Of course, he gave it all up in terms of traveling around the country about 2 years ago. In fact, we'll be having the 2-year anniversary next month. It was July of 2013 that we took it on and became the northern affiliate for the Healing and Eye and Wellness Center. And the rest, they say, is history. And just last month, added to all this by developing a cataract program of our own, one that I'm pretty sure Dr. Condrat has now put into play after we've spoken, and hopefully he'll get the similar results that we had here and start a new round of how to save people from a loss of their vision with the cataract issue well corrected. Other things, vitamin C kits, they're here, folks. If you use vitamin C, some people that really would need to, if you have an elevated lipoprotein A, you can remember me teaching about this lipoprotein A, which is a genetically acquired way to hang on to a form of cholesterol that's pretty difficult to not suffer some ill effect from, called lipoprotein A. If you do carry on to hang on to this, you need to shed that ability, and there's only one way to do it. It's a combination of lysine, proline, and vitamin C. And the vitamin C has to be following the 2 Courtney rules, which is non-corn derived and fat soluble, and should be able to be done in as inexpensive a way as possible. That's where the kits come in. We have a 2-year supply of vitamin C that we'll be able to provide you really at pennies a dose. To find out more about it, also give us a call at 724-942-3002 and ask and inquire about the kits. We have a few more left, and we'll teach you how to make your own vitamin C in a pretty inexpensive way, or at least the least expensive way we know of, and still make a form that is able to be assimilated, and once in the bloodstream can be metabolized in a way that is not harmful to you. No genetically modified anything is involved. The Monday show, should just mention a couple of words about it. I'll refer to it as the go-to show in the future. Should anybody have questions about what we refer to around here as natural chelation therapy. It's a newly discovered way of dealing with heavy metals without taking any harsh pharmaceuticals that are so common, and especially, actually, most common among the alternative doctors in the country. These are a group of people that you would think be steering clear of pharmaceuticals, but in this one arena, it appears as though it has been, I guess, okay to move into using things like EDTA, DMPS, DMSA, and the list goes on and on and on. This is a stark difference to everything else that the alternative doctor does in avoiding the use of any pharmaceuticals. For the most part, sets the general rule. But when it has come to removing heavy metals, it seems that it's okay, or at least it's been okay, to then venture off into the pharmaceutical world. That has always had a rub with me, just has not felt right. And now it looks as though we're able to move a natural by taking a mineral test, finding out what minerals you lack, replacing those minerals, and in the replacement of them, you will be able to get rid of the heavy metal burdens that you suffer from in a pretty natural way, certainly avoiding any use of any pharmaceutical substance that has the potential, at least, to cause problems with respect to inappropriate reactions and difficulty, as any pharmaceutical substance has. So this natural form of chelation, I have to thank Mr. Edward Kane, who's the CEO of the Body Bio Company. He and his very famous wife, Patricia Kane, have been a dominant force in the alternative realm and different ways of approaching and treating disease, very serious disease, and having a great impact in reversing them. And so this has been an Ed Kane contribution, and I give him full credit for it, and have now been able to pass it on to you. If you feel like you want to be mineral tested, easily enough accomplished, come on in here. It'll only take about 5 minutes to test you as you sit in the office with me, and then we can get you started on, number one, replacing the minerals that you are lacking, and two, in the process, get rid of these heavy metal burdens of things like the lead, the cadmium, the mercury, and the list goes on and on. Those are the three. Aluminum, I want to throw in there because that actually is one of the metals that we frequently see accumulates in levels that will affect tissue and make it unable, talking about the tissue now, to fully function within the bounds of these toxic substances that prevent tissue from operating at an optimal level. So we now have natural chelation. I referred to the June 15th show, the Monday show. We'll put it in the archives, and we'll make it a platinum show from this point forward. And if anybody asks me about it, I think rather than getting into a lengthy description, I'm just going to refer them, as I now do. Like with ozone, for instance, I refer you to the Dr. Schallenberger shows. And with eyes, well, it used to be the Ed Conrad show. Now we've done so many. We have a list of shows on our own, but now Natural Chelation has its own. Just referred to the June 15th version of the show we did last Monday, just the other day. And you too will find a pretty good explanation awaiting you. The Beamer is being driven around this office with great response. You know, the Beamer is a PEMF device. It was introduced to us by Dr. Todd Wiley, an eye doctor from Spokane, Washington. And his description of the Beamer was so alluring that we couldn't get a Beamer fast enough, and it is helping us with so many medical issues, some involving the eye, certainly involving the eye, but many other issues that have nothing to do with the eye are benefiting from this PEMF device. Of course, PEMF stands for Pulsed Electromagnetic Field Therapy, PEMF, and the ability to cause vasomotion and perfusion to regions with ease and rapidity is the real gem of the PEMF devices. And more on the Beamer as time moves on. All right, let's do this much. let's take a short break. And in the interim, let's connect with our good friend, Dr. David Minkoff, awaiting in the wings, it's my hope. You're going to meet the gunslinger, folks, and become completely intrigued by this gentleman who is a brilliant physician out of Clearwater, Florida. We'll be right back in a moment with Dr. David Minkoff. Good morning, ladies and gentlemen. Welcome back once again to AM Impact on Your Health. Heard here in KHB 620 each and every Monday, Wednesday, and Friday from 8 to 9 o'clock. I'm Dr. Dennis Courtney with you today in a Wednesday morning version of the show, and in keeping with always our joy and pleasure to bring you unique personalities, stellar personalities in the medical world that offer ways of treating disorders that not many people can appreciate or become involved with. Today is an extra special individual in that regard. Now, I refer to him as the gunslinger because you're going to learn on how personal Dr. David Minkoff takes the treatment of some pretty difficult disorders to treat, and his success rate, bar none, is one of the best in the country. But, of course, this gentleman has a story that dates way back. We all have an epiphany. We all have a beginning. We'll start at the beginning, but let's allow me to introduce to you the gunslinger himself, Dr. David Minkoff from Clearwater, Florida. Good morning, Dr. Minkoff, and thanks for coming aboard today.
Thank you, Dr. Courtney. I'm glad to talk to your audience.
Well, Dr. Minkoff, I've been an admirer from afar. As many conferences as I've gone to where you've been on the agenda and speaking to the group of doctors about just about anything that you've taken to the stage on has turned into a great experience for me. I had the opportunity to meet you personally at a conference recently held down in St. Petersburg, Florida, and you were as equally devastating to the audience of that group of doctors as you've been in the past. I've learned so much about your personal saga and your journey to arrive at the point you are today. It's an interesting story. So back in Wisconsin, where I guess it all began, at least your medical school experience, heck, you have a pediatric tour of duty. You've got an emergency room tour of duty. Take us through how it is that you arrived today in doing what you do.
Well, that's right. I grew up in Madison, Wisconsin. I went to the University of Wisconsin and medical school there, and then I went to UC, University of California in San Diego for an internship and residency in pediatrics. And then I did a fellowship in infectious disease, and I did research in new emerging antiviral medications. Ribavirin in the early 80s was a new medication being used, and I did some research on that. I was then in the hospital as an infectious disease officer, and I ran a neonatal intensive care unit, and I had an office practice in pediatrics, and then I got interested in intensive care medicine and bridged over and started doing emergency medicine. I was in a trauma center, and I like action. Never thought of this idea of a gunslinger, but I do like action. And so I enjoyed emergency medicine, and that's what I was doing. We moved to Florida in 1990. My wife was always interested in health, and I was interested in health and performance too. When I moved to San Diego in 1974, the marathon craze was on. Frank Shorter had won the Olympic marathon, and San Diego was a hub for athletic activity, and I started running and did a few marathons. And then in 1982, I saw the Ironman triathlon on TV, and when I saw that, I wanted to do that. So I'm still a triathlete. I've done over 40 Ironman distance races. I've been to the World Championship 8 times. So I consider it a hobby, but it's fun, and you have to have a good body, and you have to have good habits, and if you're going to perform. So what happened that got me switched over from emergency medicine into this field is that in about 1996, my wife didn't like the fillings in her teeth, and she went to a dentist and had them removed. She had quite a lot of them. All of her molar teeth were filled with silver fillings, mercury silver fillings. And shortly after that, she started getting some pain in the front of her neck, and she started not to feel well. And then she woke up one morning and she couldn't lift one arm, and she couldn't move one leg very well. And of course, this was a very, very distressing. And I had her see the best doctors that I knew, neurologists and internal medicine specialists and rheumatologists, and they said, well, it looks like she's got MS. Just didn't make any sense to me. She'd been healthy. She's a nurse. She always took good care of herself. She was a very good triathlete, one of the best in her age group. And I couldn't put this together. She was running a home health nursing agency at the time, and one afternoon when I went to pick her up, a guy walked out of an office that I hadn't noticed before. He had just opened practice, and the sign on the marquee said natural dentistry. So I thought, well, could this new illness that she has be related to something that happened at the dental office when they removed her mercury? I didn't know anything about the medical toxicology really in the form of mercury or anything like that. So I introduced myself and told him the story and asked him about it, and he said, oh, sure, that could happen. There's a very particular way that you have to remove these amalgams for the safety of the patient and for the safety of the doctor. There's special equipment, special suction, special protection. And if that wasn't done, you take a high-speed drill and you drill these amalgams out. They're about 50% mercury, and the mercury heats up and it will boil. And that will spray all over the body, and mercury is a very potent neurotoxin, so it kills nerve cells or paralyzes or damages nerve cells. And a person inhaling this stuff or going in through the throat or them swallowing it could affect their nervous system and give her the symptoms that she has. And you better learn about this, because this was 1996, I think, or 7. He said very few doctors know about this, but there is a particular doctor in Seattle who teaches physicians. You better go out there and get treated, get the knowledge yourself. And so I did. I went and spent some time out there with him. He taught me all about mercury and toxicity and how it works, how you diagnose it, and a very unique kind of nervous system examination, kind of a nervous system biofeedback examination, where you could tell what was bothering the nervous system. And I learned it, and I came back and I tested her, and lo and behold, she was mercury toxic. And when we did a urine test and a blood test on her, she had high levels. I then proceeded to treat her with this new knowledge that he had told me about. And over a period of a few weeks, she got completely better. All of her symptoms went away. And I can tell you now, 20 years later, she is still one of the best triathletes in Florida in her age group. She usually wins her age group in races. Her health is excellent. and she has no residuals from the earlier problem. So that got me into it, and I wanted to learn more because it fascinated me. And when our friends saw what had happened to her, they said, well, I've got, they started asking me about their problems. Well, I've got headaches, or my son's got rheumatoid arthritis, or my father's got cancer. Can you help them? Because traditional medicine has not been able to do much for them. And so we started a small practice while working in the emergency room. The emergency room is shift work, so it was 12-hour shifts, and I would do 3 or 4 shifts a week, and I had some other time that I could work, and we started a small practice, which then grew very fast, and it became so interesting and very successful that I transitioned out of emergency medicine and have been doing this integrative medicine and integrative oncology since that time. So that's how I got here. I'm more excited about practice now than I've ever been. I learn every day from patients, and we really see miracles every day with people who need help. They need proper diagnosis. They need something other than symptomatic treatment, and we do a good job at it.
Well, that story, I've never really heard it in lengthy fashion, and I've been intrigued by your story and how you came this distance. But the way you've just told that story has even given me more enlightenment about you and your journey than I ever had before. Thanks for taking that walk with us. My listeners always enjoy hearing how that epiphany occurred. It appears that each of us, in their own way, has a similar tangential way that they also got here. And the fact that you've arrived and since the late 90s at least have devoted all your entire time to working into this arena has continued to benefit more doctors who've been taught by you. As you began your practice and it burgeoned so large and it took you out of the emergency room, so the emergency room's loss is our gain because the David Minkoff, who was challenged by pretty difficult problems in the hospital hallway, now took that into an office practice with people came to you with complex issues that didn't seem to have an explanation. You cover, I looked at your website, it's really a who's who of what the heck is it that you don't treat. You treat literally everything under the sun. And so, although I do want to concentrate before this morning is up about one particular disease, which I feel you are an expert on, is Lyme disease, what is your philosophical approach as people treat you? What are some general rules that you're always using and follow in order to develop treatment plans that you found of benefit to the majority of people who come to you for help?
Yeah, when I see every patient, I like complex patients and I like figuring things out. And it stimulates me, and it's fun when you figure it out and they get better. So that's what keeps me going. I like to help people, and I like to see people doing well. Every person that comes in, and we don't all, our whole practice isn't complex sick people. Since I'm involved in athletics, we see a fair number of professional athletes too, who want the same thing that the sick people do, only they wanted an improved performance. The person who's got chronic fatigue or Lyme disease and can't get off the couch because they're too exhausted wants to be able to do more things, which is performance. And the elite athlete, whether it's the cyclist or the triathlete or the speed skater or the skier, they want performance too. And the approach that we use is the same to both. It's basically that since we live in a toxic planet, we are all exposed to many toxins every day, thousands of them. And these toxins get into our body through the air we breathe, or water, or food, or things that we put on our skin. And our body has a limited ability to get rid of these toxins. So the guys who have good genetics and pretty good dietary habits are able to mobilize to get rid of toxins better. The people who can't accumulate more. And these toxins poison various body systems so that ultimately the body can't make energy. The cells can't make energy, and then they don't work well. So if a brain cell can't make energy, then you can't think, or you can't move, or you can't do things. If a liver cell can't make energy, you can't detoxify, or you can't make protein. So depending on where the body stores the toxins or where the toxins end up is where you see the deficit. So everyone's toxic, and there isn't any exception. The second thing is everyone is deficient. I have not seen a patient in years and years and years who, if I measure their vitamin D level, isn't low. Same is true for many of the trace minerals and essential fats and amino acids. People just either don't eat the right foods, or they can't digest them or absorb them, and so, or they have an intestine that is damaged, or has parasites or bacteria, or they're gluten sensitive, and the membrane doesn't work well, and they just don't get the nutrients in. And so it's like a partially broken machine. The machine can't function if it's missing things that it has to have in order to work. So those two things we see in everybody. And then there's a third thing, which is, I'm going to call it allergy, but really what it is sensitivity to things that really aren't toxic. Like someone eating some fruit or vegetable or protein, if it gives them a stomach ache, or it gives them a rash or hives or red eyes, that isn't a normal reaction. The food itself isn't toxic, but they have an abnormal reaction to it. So we're calling it allergy, but it could be included as a sensitivity. So everybody's got that, and that's what's wrong with sick people. You know, when most physicians make diagnoses of quote-unquote diseases, they're not really diseases. You know, a real disease would be a strep throat. So the guy comes in with a fever and swollen glands and a sore throat, and you look back in his throat, and he's got white pus on his tonsils, and you take a swab, and you do a culture, and there's a strep back there, and then you give him a treatment, whether it's a natural treatment that kills strep or penicillin that kills strep, and the strep is dead, and the guy is better, and it's done. It's a real, definable entity. Most of medicine isn't that. The disease is hypertension, or high cholesterol, or rheumatoid arthritis, or MS. These aren't really diseases. They're great big wastebaskets, which are easy to write a code for so that you can get an insurance company to pay you, but they don't tell you what it is that's wrong. And so if you look at any of these particular conditions, you say, why is the body reacting this way? Why is the myelin being lost? Why is the blood pressure high? Why is the cholesterol high? What is it in the body's intelligence that's causing it to react this way that gives us this either lab marker or symptom? But to call it a disease is you kind of mask it, and then it allows you to say, well, I can correct that. I can give the body another poison, which is what drugs are. I can give the body another poison to make that cholesterol go down, to make the rheumatoid factor go down, to make the sedimentation rate go down, and then delude oneself into thinking that they've actually helped the person improve their health, when they really haven't, because the underlying cause of why did the body do that in the first place is still occurring, and usually what that means is that you're going to get a worse condition than you did before, because not only is the underlying cause continuing, but now you've got medication on top of it, which has its own set of toxicities. That isn't to say that medication is never good, but usually it's not the long-term answer. Sometimes it's needed for short periods of time to get someone out of an emergency, but as a long-term solution to chronic problems, it's never the right thing to do. So that's what we're trying to do, is figure out that maze, walk ourselves through that maze. What are the lab tests, the physical exam tests, the history points, which will lead us to, oh, here's what you've got. You've got Lyme disease, and you've got Epstein-Barr virus at the same time, and you've got a parasite in your intestine, and your zinc is low, and your selenium is low, and your essential fats are low, and now we have identifiable things that if we correct them, your health will improve. And that's what happens. So probably 85% of the people that we see, they get better. They get better because we figured out what is the real reason, what has gone wrong with their body in these various categories. What have you got that you shouldn't have? That's toxicity, or it could be infection. And what are you missing that you need? And then what are you sensitive to that you shouldn't be? And using those sort of three things, we can help people. So that's kind of my basic approach, and that's kind of the things I take for granted when I see everyone. Now, in someone who's on the couch for 6 months and we figure it out, well, they start going back to work. And with the elite athlete, you know, they can improve their 100-meter swim time by 0.01 seconds and be a world champion. But what occurred is their body performance got better because we actually improved their body's ability to be healthy. That
is a great summation. The three things, toxics, deficiencies, and immunological, these sensitivities, and whether you're really ill or whether you're a fine-tuned athlete and just want to improve and make your time better, using those three has been a guide way for you to help just about all comers, wouldn't you say, Doc?
That's exactly right. Exactly right.
Now,
so we just have learned various ways to look at those things and get better answers. Because the ones that we don't figure out, I still know I'm missing something here. This isn't genetics, you know. The 50-year-old person who's now got fatigue, it's not some genetic problem, you know. If they've got cancer, it's not a genetic problem. Because for the first 49 years of their life, they didn't have that. It is a response by the body to one of these three things that is causing the symptoms that we see. And if I just keep that in front of me, and over the years, what's happened is, okay, I've got somebody I haven't figured out yet. Like I did the analysis that I usually do, and I haven't figured out, and now I'm looking, okay, what else is there? What other factors? What am I missing? And so it's like detective work. Here's the clue. Where did that clue come from? What caused that thing? And there's a lot of us now that are doing this kind of work, and we really learn from each other. And we can then, so I call somebody or I go to a meeting and I say, well, what do you think about this? And he says, well, have you checked that? Or if you checked that? And I say, ooh, gee whiz, I didn't really realize that. And then I got a new little tool to throw in my toolbox, and I do that test on the patient, or I try that intervention on the patient. It's like, holy smokes, now I've got a happy patient, because now I've figured out what's wrong with them, and now they're getting better. And so as a group of integrated physicians, with guys like you and like me, we're getting better and better and better at figuring people out and at helping them.
Let me, if you would permit me, to switch some gears. Yes, your approach and this basic use of the three toxics, deficiencies, and immunologicals have carried you a long way. In particular, I've always identified you as an expert in the treatment of one particular disease, because every conference I go to, you're on the agenda as the go-to person, and that's on this subject of Lyme disease. First of all, is that a misnomer? I mean, have you been associated incorrectly with Lyme disease, or is this a large number of patients that you see in this particular category? Is that one of your specialty areas?
Yeah, we see a lot of Lyme patients. They come from all over the world. And I think, Lyme patients are in a big quandary because there appears to be a worldwide epidemic of Lyme. We now have better ways to diagnose it. And I think word gets around if you start helping people with Lyme. There are lots of networks where Lyme people talk to each other and go back and forth of what are you doing, who helped you, what's happening. and we've been very successful with it. So, people hear about us and they come for that. Of course, we do a lot of other things, but we do a lot of Lyme, and we get very good results with patients with Lyme. So, I like to help people with Lyme disease because it wrecks their life.
Well, I can tell you that in sitting in the audience so many times now where you have lectured, what comes across, and I believe it's a correct read about what you do, is you take this disease very personal, Dr. Minkoff. It's quite clear to me, and that's how I've dubbed you the gunslinger. You do not settle for not winning in this disease. It's to the benefit of your patients that you are so. But describe for us, because this is very an elusive disorder that no one has been able to seemingly master, yet you get as good a result, if not better than most. Tell me about your Lyme experience. How is it that you've come to specialize in this area? And if you could reduce it to those components of your treatment program that you felt have really taken your patients over the top with respect to Lyme's, I know I'd appreciate hearing about it.
Sure. I think that so when I see a Lyme patient, I'm thinking in the same thing that we just talked about. So I know that there is a lot of Lyme disease around that a lot of people are exposed to and they don't get it. Why don't those people get it, and why do the people who get it get it? And the reason is that the toxin load, or the ability to deal with the toxin load of the sick people is less. Either their genetics or their deficiencies or their other things don't allow them to handle Lyme. So I'm persistent at it because I know that if I can figure out what these factors are, I can get them better. Sometimes it's a dental issue. They have a silent problem in their mouth. They have a root canal tooth, or they have an abscess tooth that doesn't hurt, and it takes its toll on the immune system, and nobody's looked there, and we look there, and we find it, and then we take that burden off of their immune system, and then it's stronger, and then it can deal with Lyme better. I think the other thing is, I was an infectious disease specialist for a long time, and I would consult in the hospital on, other doctors would call me to deal with patients who had complicated, serious, people in hospital with infections. So I became an expert in antibiotics and in handling infections with people. But I just find that with Lyme disease, the traditional antibiotic therapies just don't work. If someone came to me today and said, I got bit by a tick 3 days ago, and the tick swelled up, and I've got a bullseye right now, and I'm feeling a little feverish, I would treat that patient with an antibiotic because acute Lyme does respond to antibiotics. But most of the patients that we see never knew they got a tick bite or never knew they had Lyme disease. They're being treated for something else. And we're way, way down the line. This isn't an acute illness now. This is a chronic illness. It's either involving their nervous system or their joints or their heart or their liver or their kidney or all of them. And I just haven't seen that antibiotic treatments work very well. What they do is produce a toxic intestine, and people with toxic intestines have trouble. They get food allergies, they get pain, they get overgrowth with yeast, and so now you're multiplying your problem. So our approach with chronic Lyme is to use things that kill bacteria and funguses and parasites and viruses, but that they're natural things, like ozone or silver. These are two very good antibiotics, or herbals. There are lots of herbals that are really good at killing Lyme disease. And if you get the right mix of them, you can kill these organisms. Now, these organisms are really crafty. They're really smart. And they know how to hide. They can hide inside cells. They can surround themselves with what are called biofilms, where they put mucus around themselves, and the immune system doesn't see them. And so you have to sort of get them from multifaceted approaches, so you can dissolve the biofilm. You can coax the bugs to come out of cells so that you can kill them. And then if you do this, you can get, you can have better success with people.
Now, you've become a force in medicine that if somebody develops Lyme disease, you have been a go-to when it comes to both doctors and patients to seek and get relief, because it looks as though you head right back to the basic three things. That's where you start. I guess you don't jump necessarily into the Lyme's picture without trying to figure out where the weakness was. Get the weakness determined, make the toxicity changes, correct deficiencies, and find out where their immunological sensitivities lie. And at least once you've covered that basis, then you can go off and start treating the Lyme disease in particular. Did I get that right?
Yeah, you did. I'll give you a good example. I saw a new Lyme patient yesterday. They come from far out of town. It was my first visit with them, and part of the way that I do my neurologic examination on them is to try to get an idea from their body, from what's called their autonomic nervous system. It's the part of the body that kind of runs the whole body. You don't have to think about walking or going to the bathroom or sleeping or keeping your heart beating or breathing. We have this system in our body which kind of runs that by itself. And when that system is poisoned or it's deficient, it doesn't run the body very well, and then people don't feel well and they have symptoms. So using this kind of neurological biofeedback examination that we do on everyone, we can get from the body's biofeedback, what is it that is the sort of the worst thing that it's dealing with. And oftentimes it's not Lyme. In this patient yesterday, it was what looks like a parasite, a tapeworm type parasite. So I said to the patient, the sort of priority of treatment in you is that your body's, if we could sit down and ask your body and have a discussion with it, and we sort of do this with our examination, but if we did it sort of as a live talk and say, okay, you don't feel well, you're exhausted, and you have pain all over, and you can't think, and you weren't like this 5 years ago. So body, what should we do first? What's the right priority to help you? And it's kind of the analogy would be this. Someone's laying in the jungle on their back and they're unconscious. And you run up to them and you do a very quick visual survey. And you look at their right arm and you see that there are red army ants crawling up their arm. And then you look at their left arm and you see that there is a family of black widow spiders walking up that side. And then you look at their right leg and there's a boa constrictor that's coiling around that leg. And you look at the other leg and you see that there is a panther with great big canine teeth and saliva dripping off the tooth, just about ready to chomp that person's leg. And you say, what do I do first? And everyone in that situation would say, oh, first shoot the panther, then shoot the boa constrictor, then get the black widow spider off, then deal with the ants. If you did the ants first, you'd be wrong, because the big threat was missed. And so when I look at someone, I want to get what is the big threat based on the body's response to what's the big threat. It's not my idea of what the big threat is. It's what is the most damaging thing to the body. I have seen doctors have patients come into their office and say, oh my God, you're mercury toxic, and you've got a mouthful of amalgam. and they treat that patient with some kind of chelation, or they take the amalgams out and then they do the chelation, and the patient gets worse. Well, why did it get worse? Because that wasn't the big problem. They had problems that had to be fixed first in order to even handle that problem of the heavy metal. So if I shoot the panther, get rid of the boa constrictor, then get the black widow spider, and then get the ants, I'm doing it in the order that will cause the body to survive the best and react the best. So this patient with Lyme disease came in, and I said, you know, I am finding evidence of Lyme disease in your body. You have it. But the priority is you got a parasite load in your gut, and you're autoimmune. And you've got herpes type 6 virus. And those are more of a threat to your health right now than the Lyme. And we have to deal with those first. Because if we get those off the plate or off the table, so to speak, your immune system will be stronger. And then when we go after the Lyme disease, when it is actually the priority, you'll respond better and we'll get a result. And so that's how you win with these things. You've got to get tuned into the patient's body, their nervous system. What are the threats? What is the proper order or sequence that you handle them on? Then you're working with the body's innate intelligence, and you can get results.
Fascinating story, Doctor. I like the thing with the panther and the ants. That's an analogy I'll never forget. When these patients are arriving now, and you have developed a reputation out there, the gunslinger reputation, I believe, is an appropriate one. You will take on all comers, and you will figure out a way. And you will let yourself, patients that come and travel, is it true that you have a time frame, a 3-month window that they've got to be on your page doing what you tell them to do? Have I heard that wrong, or have I heard that right?
Say that again, didn't quite understand that.
A 3-month treatment window. When you work with patients, you really insist that they devote 3 full months of their time and effort to your treatment plan. Have I heard that right, or is that wrong?
Well, I think it depends on the patient. You know, if someone's coming from out of town and they're really sick, you know, they're in a wheelchair or they're really sick, then I'll tell them, I need you for 2 to 3 months. I need you to come here for 2 to 3 months because this is going to take a while and you're going to get intensive treatment. If a person's living locally, it's less intense because they're often working and we don't get as much time with them. So a lot of it just depends on what's wrong with them and what I feel is needed. You know, I think I had somebody come here yesterday who'd been getting daily treatments for 6 months with another physician that's in our area. And they weren't doing any better. And I tell patients, you will know within a few months that what we're doing is either working or not working. And if I can't figure you out in that period of time, I'm going to try to find you somebody who maybe can. You know, I think for patients, the right attitude or the right perspective is that, you are seeing progress. You are seeing things happen which are giving you progress. It isn't always smooth. It tends to bump up and down. But when you look back a month before, 2 months before, 3 months before, gee whiz, I am better. You know, I had a Lyme patient yesterday. I saw him in follow-up. He came here, he couldn't walk. Now he's walking. He's still going through quite a bit and he's had Lyme disease probably since he's 5 years old, and he's 35 right now. So in 3 weeks, he was walking. Now that's progress. And he said to me yesterday, it's still pretty tough, still going through it. But he said, I am so much better, and I can see that what we're doing or what you're doing with me is working. I'm still getting some die-off reactions, but I'm getting stronger. I can do more. I'm getting better. I know that if I just stay with this, I'm going to be okay. And that's, I think that's a proper way to look at the thing.
Well, your results bespeak of how intense you handle and take on very personally the medical problems that are presenting to you every single day. And I have been so right on, I believe, in referring to you as the gunslinger, because I've got I get the impression, even in listening to you now, that you won't settle for anything other than optimal results, and you will take any length, go to any extreme in order to achieve them. And my hat is tipped off to you, Dr. Minkoff, and pleasure to know you and to call you a colleague. Anything up and coming? We're coming right to the tail end of this show, and maybe sometime we can do this again. But is there anything coming up and coming new in the Dr. Minkoff world that you think you'd like to reveal to us in terms of any new treatments that you're assessing and evaluating? Seems to me that you're always looking for something new. Anything on the radar screen?
Well, I think that I didn't really talk about this. Back when my wife got sick with the heavy metal poisoning, the things that were available to treat it without using intravenous therapies were pretty limited. They're all pharmaceuticals. And so I worked with a biochemist to come up with a product that is called metal-free, and it was a way for patients to take a product. It's a spray. You can put it underneath your tongue, and it's a really good heavy metal chelator, which means it takes the heavy metals out, and it worked really well. And so we started a company called Body Health, and we have a bunch of unique products that really help with performance and detoxification. One of the new products that we have is called Perfect Amino, and one of the common things that I find with patients is that they often either don't eat or can't absorb enough proteins to keep their body in good shape. And this Perfect Amino is a tablet. It's soon to be a drink where patients can get amino acids in so that their body will, they retain their bone and their muscle. And for performance athletes, it's fantastic because they can recover much faster. So,
always something new in the drawing board. Tell you what, we got to get on out of here. I'm going to be checking out Body Health and maybe ask you to come on back and talk about some of these unique products you're developing. It's an aspect of you I think it's time to explore. Thank you so much, Dr. Minkoff, for allowing us to invade your morning. Look forward to speaking to you in the near future. Thank you.
Okie doke.
There you have it, folks. Dr. David Minkoff, the gunslinger himself, and I guess you know why. Hey, I want you to have a wonderful day today. Look forward to being with you on Friday. Until then, this is Dr. Dennis Courtney saying so long for AIM Impact on Your Health.